Yeah, I'm Ka Heng from Winnox Cosmeceutics Malaysia. Basically, today I will share about my research work about the microbiome-inspired family hygiene wash, a comprehensive characterization and co-intervention approach for Bacteria vaginalis. Basically, to give you about the ground, what is the Bacteria vaginalis (BV) is a pathogenic condition that characterized by dysbiosis of vagina microbiome leading to the fishy vagina discharge order coupled with certain clinical symptoms like vagina itchiness, redness, swellings, and so on. So in the normal condition of the healthy women, there is a domination of the commensal bacteria lactobacillus. So this lactobacillus is responsible to produce the lactic acid hydrogen peroxide to suppress the overgrowth, to suppress and prevent the bacterial infections. But for women that are infected by PV, there is an overgrowth of the pathogen bacteria such as Gardnerella vaginalis that form the biofilms and induce the vaginal inflammations. At the same time, these bacteria that produce the amines compounds that contribute to the fissual order of the vaginal discharge. So one of the problem statements for the PV basically is commonly use the antibiotic to treat this disease with a very good cure rate, but the effectiveness of the antibiotic is maybe not that. The recurrent rate of the PV can be very high with these antibiotics, even with these antibiotic treatments. So what we hypothesize that it's crucial to maintain the vagina microbiome profiles to reduce the recurrence of the PV. So this leads us to have our objective first to characterize what is the vagina microbiome profiles and also information profile among the Malaysian women that are affected by the PV versus the healthy subject. And also secondly, the most important objective is to explore the usage of the family hygiene wash as an alternative treatments or co-intervention to manage the PV. So in terms of methodologies, we conduct the clinical placebo control trial. Firstly, we recruit a healthy subject and also the patient with the PV that confirm with the commercial diagnosis kit, and we further randomize into two groups. Both groups also receive the antibiotic because it's a disease. At the same time, one group is having the active compounds of the family hygiene wash treatment. Another group receive the placebo. After 2 weeks, they were asked to go back to the clinic to receive the gynecology assessments, and at the same time to get the clinical specimen for the further profiling. At this point of time, they were asked to stop to use the product treatment and further monitor the assessment for another 1 month on the recurrent rates. So before the clinical trial, we have developed our formulations to incorporate three key strategies: antimicrobial compounds to suppress the bacteria, and also the prebiotics and paraprobiotic compounds that try to rebalance the vagina microbiome profiles. Lastly is the anti-inflammations active to suppress the vagina symptoms. So we also developed a very unique in vitro assay that we use the pathogenic bacteria lysis, Gardnerella vaginalis, to extract the lysis as a stimulator to promote the vagina inflammation, and with that we treat with the product for only 10 minutes and evaluate the interleukins 8 as a biomarker for inflammation to know what is the anti-inflammation properties of the formulation. Plus, we also done some antibacterial tests to know the instant killing of the formulation and the long-lasting antimicrobial activity. So, in come to the result, there are two main key results that we have. First is on the profiling of the PV on the vagina microbiome and inflammation profile. When you look into a 16S study, there is no difference in terms of the alpha diversity, but in terms of beta diversity is very distinctive difference. So from here we can tell there is dysbiosis of the vagina microbiomes between the PV and healthy subject. So come to the genus level. we can show the lactobacillus is significantly depleted. So from here, the significance is quite confirms that lactobacillus is a commensal for the vagina. And at the same time, we found the potential pathogenic bacteria, which is Cynthia and Puentoria. But the 16S is a bit insensitive, so we're trying to confirm using the PCR. And with the PCR result, we can confirm the species Puentoria pivia and also the Cynthia sanguinogens are the key species defined as a pathogenic of the PV progressions. So at the same time, we evaluate the inflammation markers. Interleukin 1 alpha, 6, 8, and TNF alpha, all is highly regulated versus the healthy group. So from the first part, we successfully characterized the microbiome's vagina microbiome is significant difference, and also inflammation marker is highly evaluated in the PV subject versus the healthy. So come to the second part, we're trying to explore what is the possible usage of familial hygiene wash as a core intervention to manage the PV. So before that, from the in vitro study, we can see a very good selective activity of the active compounds, active formulation with a stronger and selective anti-pack versus against the Galinaria vaginalis, but placebo is much lower in terms of log reduction. But for the commensal lactobacillus, there's no difference. So we also from this susceptibility assay, we also confirm the selective activity that form a very good strong zone of inhibition on the Galinaria vaginalis, but not lactobacillus species. So in terms of anti-inflammations, the unique model that we developed with the Galinaria vaginalis lysate able to promote the interleukin 6 elevation of the secretion of interleukin 8. But with the treatment of our active compounds, you can significantly suppress the inflammation secretions. So with the in vitro test, it makes us confident to move on to the clinical evaluation. So let's come to the clinical evaluations. There are three parts on the clinical symptoms, anti-inflammation properties, and the vagina's microbiome profiling. So in terms of clinical symptom, you can see both treatments that have a suppression of the PV because due to the antibiotic treatments. But when the product was stopped, the subject when come back to the clinic, we can see the recurrent rate on the placebo treatment group, but the active group continue to suppress the previous symptom. So this data confirms that the familial hygiene wash has an adjunctive effects complementing the antibiotics. And when we see the clinical symptom, although there is no significant difference between active and placebo, but in terms of the improvement quantum is much better compared with the placebo. So the second part, we evaluate the inflammation markers. All inflammation markers basically also suppress. But only the TNF alpha placebo have no effect, but only our active have a good suppression effects. I think interesting is after the product stops, the interleukin 1 alpha is research and such high after the product stop cessation, but our active able to continue to suppress the secretion of the interleukin 1 alpha. So this proves our finding demonstrated the long-lasting anti-inflammation properties that complementing the antibiotic treatments and also outperform the placebo. So come to the very important piece of the result, which is the vagina microbiome balance. So if you remember the first part, we identified the commensal and also the pathogenic. We calculate the ratio between the commensal and pathogenic to arrive to the vagina microbiome healthiness index. So in healthy women, they have very good index, but for the PV subjects, they have a very low index. With the treatment for antibiotic, they will restore to a certain degree, but only the active treatment can continue and long lasting. So also the effect is outperform the placebo. So for the very first time, we have shown that the familial hygiene wash can be a core intervention to manage the PVs, to complement on the PV management. So for the whole study, we able to answer two key objectives. One is One is first we characterize the vagina microbiome profile and information are different versus the healthy woman. Secondly, is also, we also prove the possible use of feminine hygiene wash as a core interventions to that able to rebalance the vagina microbiome with the long-lasting anti-inflammations, eventually contribute to reduce the recurrent rate of the BV. So we're able to prove this possible use of feminine hygiene wash as core intervention, and for the first time to promote the woman's reproductive health and well-being.